since you've been around people who have died and come back, and this is a total segue, like this has totally got nothing to do with what we're talking about, but any near-death experience stuff that you've heard or seen?
You know, so I also work in palliative care, and I'm around death and dying a lot. And I've never heard from a patient of seeing the light or any kind of moment like that. But there are times, JJ, it's hard to describe that. Sometimes when you're in a room when a patient's actively dying or they pass, sometimes there's just like a general feeling. It's hard to describe. Like some people will say like it feels like a spirit is in the room or left the room or something. And I haven't experienced this with every patient or every circumstance, but sometimes there's just like it feels like there may be a presence, and it's tough to quantify or to describe, but yeah, to answer your question directly though, I've never heard from a patient that I've been involved with that, I saw the light or anything like that. But one thing I do see very frequently, JJ, is that patients know when they're going to die, which is often a bit spooky because sometimes they'll look fine and they'll go to you like, Dr. K, like, I'm going to die tonight. And as a young doc, you'll be like, oh, no, you're fine. Your vitals are good. Like, things are fine. And that night they'll die, or the next day they'll die. You see some fascinating things in this line of work.
When Grant was able to finally start talking again, he told us about the gray man. He told us about all the places he visited in the hospital when he was lying in the coma, and described exact situations that he never would have known about, like where we were sitting, what we were wearing. I'm like, okay. And then he described the gray man, being on the other side, what it was like, being given the choice by the gray man, and deciding to come back because he kept hearing, because I would sit and talk to him in the ICU. So I was like, there's definitely something more out there. That's all I know. Because he says no space, no time, and it's just beautiful. So let's go back over to the health stuff. So being strong, do you have any specific recommendations that you like to give patients? Do you get the opportunity to give patients these recommendations, or are you just like getting them out of the dire straits?
So JJ, this is one of the gifts that has come to me recently. So to answer you directly, no, my patients I don't get to have that conversation with patients most often. Often they're unconscious, often they're delirious, and they're not aware of their surroundings. Occasionally, I've had once a patient ask me about ketogenic diet. The patient was morbidly obese, and I was so encouraged that they were willing to look at lifestyle modification. So I threw them a bunch of resources because that was of interest. But the gift of the last few years, JJ, of being able to have platforms to advocate for some of this stuff has been an absolute blessing. I can't tell you, I mean, you know this because you live it, but how rewarding it is when someone comes to you and say, my mom now is no longer on diabetic medications. My mom now is like down 10 pounds and is physically stronger. So you could see her bicep. Like that to me brings me so much joy because you're changing a complete trajectory of someone's life. And in the ICU, it's one-to-one, right? Where when we're doing right now is getting to thousands of people. And whether it's half a dozen, whether it's 100 of them that this lands with, it's so beautiful. It really is inspirational to me. So to get to your question, so I basically like to, when people I get a chance to talk about this stuff, either on our show or when people track me down, I like to really try and meet them where they're at. And I think one of the things that is the most important thing when it comes to getting strong is personalize it. Some people are afraid to go to the gym because they're intimidated. So what are the body weight exercises that you can do? And I'm personally a belief of, if you ask me what I think is the most effective 80-20 of getting strong and staying physically active, I'm a big fan of compound lifts. Like, I think there's just
Yep.
huge bang for your buck. You squat, you deadlift, you press, you hinge. There's such beautiful exercises that in fact involve your whole body, right? And depending on what your goals are, like, I'm a big fan of five by five. So, just incrementally increasing that weight. So you're aiming for 5 sets of 5 reps. As I've aged, I've actually, in terms of focusing on more high intensity interval training involving weights, like we will do a Tabata workout with kettlebell, doing kettlebell swings, Tabata workout for hang cleans, like things like that. But the average person that comes to me, if they're serious about trying to really get strong and increase their lean muscle mass, push weight, compound movements, and you're always, in my opinion, going to get results.